Last month, we exposed how hospitals have lost £1 billion since 2010, a financial penalty paid for having high numbers of patients admitted through their A&Es. Today, we reveal grave concerns about how that money lost to hospitals has been spent by other parts of the NHS. The cash withheld from hospitals goes instead to clinical commissioning groups, or CCGs, the bodies led by GPs which now control health budgets. A CCG must spend the cash on initiatives that reduce the number of patients that end up admitted to hospital as emergencies. Using the Freedom of Information Act, we asked England's clinical commissioning groups if they had set a target for measuring the success of their initiatives. In the last financial year, just 1 in 4 CCGs had set a target for reducing emergency admissions and met it. All the rest had either not set a target, not met it, or didn't know their performance.
Judging by this data, it seems that up to 2/3 or 3/4 of CCGs have not done what was asked with that money. And that's one of the reasons that this winter has been so much more challenging, with patients waiting on trolleys for a long period of time, because the money has not been invested where it should have been.
So what kind of initiatives are working? Well, this practice is piloting 2 ideas: GP cover at weekends and doctors visiting care homes to check on elderly residents. But the doctor in charge admits he's uncomfortable the money has been diverted from hospital patient care.
Well, more money for commissioning services is always welcome. However, fining A&E departments for not meeting targets may not be the best answer.
The body which represents clinical commissioning groups says CCGs are spending the money effectively, but there are no shortcuts to success.
Some people might have been too ambitious in the targets they set themselves. Sometimes these schemes just take longer to get up and running than you expect them to. It doesn't mean we should stop doing it, it doesn't mean these are the wrong things to do, but there are huge challenges.
NHS England says it'll provide guidance to CCGs about how to spend the money they gain from the penalties hospitals pay. Keeping people out of A&E is a complex challenge, all the more important that the money invested in that is well spent.